27, that's on the second floor. Now, would you like to just sign, just as you have the keys?
Just the next one down?
Yes.
Yeah, fine. That big's in the bedroom. Oh, look.
Well, I came here on the Sunday, you know, to move into the nurse home. It was pouring with rain and I felt so fed up, and my little room had nothing on the walls, you know, but there was other people there as well, you know, in the same situation. I think it's the start of your new career sort of thing.
I was petrified. Absolutely petrified. I thought, oh, I'll never get used to it. I'll be lost. But I mean, you soon get used to it, you know, you find out where everything is. It's great. Yeah, wondering if I was going to meet, you know, people that I was going to get on with and whether I was going to like it. It looks a bit enormous and, you know, impersonal, but you find out everybody's friendly. So things inside to put over the...
One, two.
Right.
Should I do the hook first?
Yeah, you better.
There you are, nurse.
We all went into the big hall and she sort of assigned us to various groups. And we just settled in and we started off straight away, you know, doing the anatomy and physiology.
The liver actually lies immediately underneath the diaphragm. Right, and the diaphragm, you remember, lies at the base of the lungs.
I don't know, you're learning so much. You've got to know all the
You have
disease processes and the anatomy and physiology. It's not just the practical side. You've got to do the theory so that you know what you're doing in the practical side.
So that when the doctor does an abdominal palpitation, he cannot feel the liver. It's only if there is something wrong with the liver that it extends below this level here and can be felt.
Tuesday we had, you know, lessons and in bed making as well. We had pages and pages about bed making.
Fine. Yes, we're going to roll you over now and towards me. Okay. So you go over a lump. Shouldn't be too comfortable. That's it.
You felt pretty stupid, you know, as if, you know, it was supposed to be so easy, and I just couldn't. I thought, oh, I'm never going to be able to do this, and took it in the right way, but you soon pick it up.
Yes, thank you. What did it feel? How long since
I thought, oh, I couldn't stand cleaning somebody's teeth, but we've done each other's and had to do it on the wards, so, you know, don't mind. So many patients you come across who just can't do it themselves. That's very important, to keep their mouths clean.
Wind this corner. They role play actual disorders that patients suffer from. Now, when you really start to think about a disorder and put yourself in that role, you then understand far more about what it must feel like.
I felt awful because the others were trying to do so much for me. And I looked very unappreciative. All I did was glower at the floor the whole time. And I got a bit irritated by the permanent going over a bump now, and I know it was necessary. I felt very shaky every time we went up or down a curb or round a corner.
How do you suppose? Where are you going now? Stand up, Wade. Oops. All right.
It's just, I got to rely on two people. I couldn't help myself. And I wanted to help myself. I wanted to just get up and get in the car. But I couldn't do it, and they were sort of one going one way and then one going round the other way, and one holding the door and shall we have the brakes on or off?
Nurse Palmer, you acted the role of a blind patient. Can you tell me what it felt like?
I felt very exposed.
Did you?
To everything, really.
Come in.
Yes,
That's it.
is it very long?
No, we're nearly there now. Stop now.
Right.
There's a man in front of us.
Oh, we're in a queue, are we?
Yeah, but there's only the man.
That was a bit weird. Well, first of all, I was feeling along the counter, and I didn't know how long the counter was. And it didn't help at all, really, except that I stayed near the counter.
I felt very helpless.
So I didn't know what she wanted to know, you know, whether she wanted to know the floor surfaces were changing or we were coming to a darker area, or what she wanted to know. Okay, we're going to have to turn right round. Can you hold on to my elbow because I've got a tray in my hand? That's it.
Oh, yeah.
That's it. Right, we're turning right round.
Okay.
We're going round a table. Their chairs are out. Can you feel them?
Yes.
Now we're going onto some carpet.
Oh, yes.
Careful, the chair's sticking out. That's it.
And then when we were going along to the table, having to go through a
Now come
confined
to another
space,
table.
and not knowing how confined it was, I bumped into a lady.
Yeah. Got to
go
squeeze
round.
through here. There's a lady one side and a pillar the other side.
Well, which side is... Oh, that's the
Pillar's on the
lady.
left, yes.
Sorry.
Okay.
Oh, we get into the table?
Yeah. Here's a chair. That's it. And the table's there, that's fine.
Can you imagine then what it must feel like to lose your sight?
East 2A is a medical ward involved with a great variety of medical conditions. For most of the girls, it really is the first time that any of them have set foot on a hospital ward. What you try and first of all do, I think, is to put them at their ease, you know, to try and lessen as much of the anxiety as you possibly can.
Extremely frightened, scared to death. I remember walking up to the ward and really, really shaking and awfully scared. And everybody was very, very nice. But, you know, so stand around and somebody would say, fill up a linen trolley. So filled up a linen trolley and wondered, did I get it right? Because that's the right way to do it. And really thought everything was awfully important.
Right, Brian. Shall we change a drip for you?
Oh, in the early days, when they go onto the ward, it really is rather frightening. There you are, with a ward full of patients, some of whom will be very ill. Usually she will work with a more senior nurse. Very often it will be with the nurse who was in the group in training previous to her, and they are often the most helpful because they remember very, very vividly what it was like to be in the same position.
It started to drip again. And you regulate it to the right speed, which is 1 litre in 6 hours. So it's 54 drops a minute.
You start off and you do a few wards here and there, and it's general medical, general surgical. And it's so new, there's so much to learn and there's so much to find out about.
Morning, Mr. Fitzgerald. I'm just going to take your blood pressure.
When they've been on the wards, say, for a continued period of time, and then they'll be allowed to do those things that they've practiced under supervision on their own, where there isn't, you know, there isn't going to be any stress for the nurse or any danger for the patient involved.
So I had X-ray yesterday as well.
Did you?
Yeah, they ain't got the results yet. I've seen new tablets.
Must be.
And the nurse, I think, gets great satisfaction from this contact with the patient. She learns how to communicate and get on with the patient very quickly, someone that she's never even met before.
Is your mum coming to see you this afternoon?
Yeah, it's my sister.
Well, Mr. Gurevich needs the discharge today. Today or tomorrow. And not on discharge.
I think one must get over the fact that nursing is purely for the women. Men have a lot to offer. I think they're as equally as caring. I think the Brothers of St. John, who in fact were the sort of the institutors of the nursing profession. I mean, as long as people care for other people, then I think there is always a role for men in nursing.
Advise him as to when you can start work. He works as a car worker, so it involves a lot of lifting.
How are you this morning?
It's better, thank you.
How's your chest today?
The wheezing's gone a bit. Still got a bit of wheezing, but it's still got it.
Are you still coughing phlegm up?
Yes.
What colour is it?
Semi-dark and light.
Yes. Have we sent a specimen?
Yes, we have. We're waiting for results.
Can I just have a little listen?
Well, normally when a doctor goes to examine a patient, the nurse, if she's available, will often go with him. And as she's been on the ward all day and has seen more of the patient probably than the doctor has, she can help him.
That's fine. How much has come out in the last 24 hours?
Only 5 mils.
5 mil.
And the wound itself is quite dry.
Right. Are we shortening the tube yet?
It's been shortened twice.
If you ask questions, they will stop and bother to explain things. You mustn't be afraid of asking questions.
or you'll never learn anything.
His jaundice is going down as well.
Yes, it does look better. Is that because he's taking vitamin K, or is it just a natural result of the operation?
It's mainly because of the operation, but we gave him the vitamin K before the operation because he would probably be short of it. You don't absorb vitamin K very well from the bowel when you're jaundiced.
Make sure you're the right person. What's your name?
Morgan Findlay.
And your address?
14 Fernwood Croft, Kingston.
Morgan Finley. X. 796516-2. 796516. Paul Steve?
No.
No hair grips? No, those only
Not this week.
Okay. The right one.
No x-rays.
No x-rays. Hello. Just seeing the patient off the ward.
I'm a bit nervous.
Look, when you come back from theatre, we'll be able to give you a painkilling injection. That'll make you sleep. And you should settle down after that, and when you wake up again, you'll be able to have another one. Okay. Shouldn't be long. How long have you had this then? 2 months? Does it cause you much trouble?
It's gone on for like 2 years. Suddenly figured out.
Okay. There'll be a needle prick. I'll try not to hurt
sleep in a
you.
minute. Is that right?
Yeah.
Am I hurting you at all?
No.
Quite happy?
Yeah.
Keep an eye on his pulse, nurse. Will you? Open your mouth.
See you later. There's a man with cancer of the bronchus who was at sort of early stages, you know, he was still up and about and he was fine, but noisy with his breathing. So I'm sitting there writing at the desk and I hear this all the time, and then all of a sudden I'm aware that it isn't there anymore, so I go along really frightened. What's this? And he was dead. Well, yes, he was dead. But then I thought, oh, you know, cardiac arrest, 222, so that's exactly what I did. And this auxiliary ran off and everything. It turned out the man had been dead for quite a little while. That was my first emergency, I suppose.
Just loosen the tape.
Between the 12th and 16th month of training, nurses do the first of 4 assessments that they have to do throughout their 3 years, when they have to do a dressing on a patient assessed by an examiner.
I'll just get everything ready now.
The main thing we are concerned about is whether the nurse is safe, that she can do the dressing without hurting or damaging the patient or his wound, that she doesn't actively introduce infection.
It's not too bad at all.
We see how she copes with the patient if the patient is nervous or if it's a particularly difficult dressing, because we give marks for the nurse's relationship with the patient.
There we go. That's fine.
Can you tell me a little bit about William's wound?
Well, he had an appendectomy 2 weeks ago and he developed an abscess.
Now, the equipment that you used on your trolley this morning was all sterilised. What means of sterilisation do we have available?
Autoclaves.
What do you understand by that?
It's like a pressure cooker, steam under pressure.
Do you know the amount of steam, the amount of pressure we use?
15 pounds per square inch for 20 minutes.
Fine. I think I've asked you enough questions now, Nurse Garner. I'll put your mind at rest. You have passed. You've done quite well. I'd just like to make 1 or 2 comments, though. I did feel that when you were doing the dressing, you should have been a little bit more careful in the position.
One of the practical assessments she has to do is the safe administration of medicines and drugs. And as the nurse said to me at the beginning of the round, you know, what she was aiming to do was to give the correct drug to the correct patient at the correct time.
James Marsh, G128778.
That's right.
Here you are. Thank you. Just a moment.
Then you get sent off in your little specialities and to maternity hospital and all that kind of thing, and children's hospital and psychiatric and all this kind of thing, which is all totally new yet again.
Morning, Mrs. Lee. How are you today? Not too bad? All right. Just going to give you a little wash now. All right, I'm just going to strip your bed down. Let's just take this top one. That's right.
I went into it thinking, oh God, you know, geriatrics, but I really enjoyed it, and I enjoyed the old people, and especially on this, you know, on the assessment ward.
Got soap on your face? Hey? Yes? Hey? Close your eyes, here it comes.
How's that feel? Is that better? Let's sit you forward and then take your nightie off. It's very fast moving, very fast paced. You get a lot of enjoyment out of it, I think, really. You come off feeling very tired, but the day goes so quickly.
Got a nice clean sheet under you. We're going to go the other way now.
Over to me then. Over you come.
That's it. That's good.
My grandparents are all dead, so I've never really come into contact with old people. Not ill old people. I didn't really have any idea what it would be like nursing old people. And then when I went to the other ward, you could see them, you know, getting better. But it's nice to see them when they're better again, you know, because they're more chatty and they're more friendly. But it's very rewarding, you know, if you see them when they're well again and going home, and how pleased their relatives are when you made them better. They're ever so appreciative, you know, and they can't thank you enough.
There we go. There we are now.
Well, I can't go in with these clothes on.
No, we're going to take your clothes off.
Some undressing on me, some taking photographs. Oh dear.
Hello, lovely. How are you? I just come to examine you. Okay. When did you come in?
This morning.
I tell us different from general nursing, really. Happy place. You've got to make it as happy as you can. And then obviously you've got to be patient because you're dealing with two patients, really. One you can see, one you can't, which is the baby. Well, that's the foot sticking out again. Doesn't want this. So you've got to be honest, reassuring as well. Yeah, the head is down. Just going to listen to the baby's heart. That's fine. The baby's kicking well. Can you check it for me, please?
That's right, ducks. And these? Brown bears? And that one? Polar bears. Well done. And that? You know what that is?
Cow.
Cow. What does a cow produce? Mm-hmm. And what do you drink that comes from a cow?
Milk.
Milk. Good.
One day I was playing with my friend Kerry. We were jumping across the ditch opposite Kerry's house. When I was jumping across the ditch, my ankle started to hurt.
The SCN, we do 2 years training, and the SRN do 3. And we're more practical than theory. You know, they go more into theory than what we do. And we're sort of more bedside nursing.
Get me to my bike on the lawn. I had to walk home because I wasn't able to bend my knee.
You don't have quite so much responsibility either. And you work with the children a lot more, or whichever ward you have to be on. You work with the patients a lot more than what you do if you're SRN. I prefer to spend my time with the children more than I do sort of sitting at the desk writing anyway, so, you know, it suits me fine. I mean, I think it's a good course. You know, I'd sort of advise anyone to do it, really.
And the lady said we had to go to the doctor in the room too.
At the end? You haven't quite finished it yet, though, have you? No, that was lovely, wasn't it? Very good. You're going to take that to school when you go back?
Yes.
Fair enough. I'll put it up there. Right, you're going to go to sleep now, then? Shall I put this down? There we are. Okay. Put your other teddy in there with you. Okay. Good night.
Good night.
I'll put the light out.
You've got one there.
In psychiatry in particular, we do a lot of big groups, just starting off with fairly basic things in cooking and household things, and then gradually building it up so that they are able to look after themselves. The nurses come to us to work as part of the team. The idea of not wearing uniform is really to try and prevent a barrier between patients and staff.
Come on. I've got orders to pull your leg and I don't know which one. Don't flinch when you nip it. What are you, 15? You're making him blush.
I see what they mean now, yeah.
Yeah. So, well, if you put on that ring now, and if you put it on slowly, so that'll cook.
About 3.
Yes, that'll be fine.
Nice like that. No,
You think you can do
pick
it,
it up,
Rose?
bring it here.
Cut this end a bit
Waiting
off.
to hear his line.
That's right. No, but you can't. Never mind.
And then we'll do another visit. This one that we're about to do is a routine visit to a school-aged child and a 2.5-year-old. Good morning, Mrs.
Morning.
Brennan. How are you today?
Very well, thank you.
Do you mind if I bring my student in today?
Certainly.
Good. Thank you. We'll get to the school clinic, and then the nurses and the doctors will have a full record of his medical history before they actually see him for the first examination. The sort of things I've got to complete are, has he had any major illnesses or operations, which he hasn't. Can you stand it for me, please, now? Have a look at his eyes. We know he hasn't got a squint. And look into his mouth. Nice wide, say, if you please. He's a good boy. Make a note of if the child wears glasses, which he doesn't, and any congenital abnormalities. In fact, anything which could be important to his education at school.
So I've asked staff nurse if she'll take you to introduce you to 263s and work on the left-hand side of the main ward, and these rooms up here. And then Doreen, if you and...
The Part 4 assessment really is a culmination of 4 assessments which are carried out during nurse training. With a Part 4, however, what you're looking for is the management of a ward of patients. So what we're looking for mainly is that the staff are aware and have the knowledge which is given over during report, and then sort of carry out the work which is to be done.
Who's going to do the what?
Bill.
Oh, I am. I'll take one of the 263s with me and go around to them, because it's... Yeah, it's done.
And I'll see you later on.
Okay.
You all right, Bill? Aren't you going to talk to me anymore? To put on you? Can't have you going around with nothing on.
I've had them clean last night.
You haven't got any on though, have you? Somebody must have taken them off during the night. Mrs. Bristow. Hello, pet. Have you got a lot of pain? Have you got a lot of pain?
Friends?
Pain.
No.
No.
Well, here was somebody who had taken a lot of care and paid a lot of attention to the patients on her ward.
Not family.
Have you, pet?
That already.
Your sister rang up this morning to see how you were.
Ah.
All right. Yeah. I told her that you had a good night. And she'll come and see you later on today. All right.
Seem to be doing all right with your fluids. She's a bit deaf, is she?
Yes, sorry.
If somebody does a Part 4 assessment, the ultimate question really is, would you like to be looked after by this person? Does she give you confidence? Does she seem to be in control? And does she have the awareness and the knowledge of each patient and his need? How do you think you've done?
Terrible. It's difficult to say, really. I mean, it's not a very true situation. The whole thing is, you know, knowing that somebody's watching you doing your work. It's not very easy.
The problem about it is that there is nothing sort of definite. But in the main, I think you've done well enough. And I think on this occasion we can say that we've passed you.
Thank you very much.
Great fun. Great. We all got our long caps. All the girls running about with their long caps on and their own clothes. Don't feel you can tell anybody what to do until you get your long cap qualified, and everybody expects you to tell them what to do, and everybody expects you to know. Okay, I'll help you up now. That's it. And if you just turn round towards nurse there. After you get into your white dress, that's when everybody thinks she's a staff nurse and forgets that, you know, a brand new staff nurse. So everybody else's attitude changes towards you. Like doctors wander onto the ward, all they see is a white dress and think she knows what she's doing, and ask her to do this, ask her to do that. And relatives all think your sister and know everything and ask you about all sorts of things. What have you had this morning?
Well, they got me up to date as yet, but I just had a glass of milk.
A glass of milk. Did you have anything when the tea lady came?
Definitely.
You had the milk.
Yeah.
Okay.
I've had nothing since.
Like 150, 650. And you're restricted to 2 litres today.
Yeah.
Okay. Do you remember that a staff nurse qualifies at the age of 21, which isn't very old. She's dealing with people that are, you know, middle-aged, old people, intelligent people. And it's difficult for them to take sometimes things from a girl of 21, but when she's got a uniform on, they accept it. You know, often you do things for patients and you wonder to yourself, why am I doing it? Am I doing it because I'm doing it because I really like this patient, or because I really feel sorry for them, or I want to heal the sick or something? Or are you doing it because you're doing your job properly, you're being professional about it? And you think, oh, well, you go and do this, you'll turn them over, you'll do all the things you have to do. And sounds pretty corny, but if they say thank you, or just some little something, it really makes you feel very good.
I'm not worried now, not with nurses around like you.
Smashing.
Right.